Welcome back to this week's episode of the Feds, Insiders for Accountability. I am Stephanie Weidel. Today we have a very full episode for you, but before we begin, hit those like buttons. They make a huge difference. Leave a comment, and if you haven't yet, follow our channels. Support the podcast and join us in our mission to protect Americans from government overreach at fedsforfreedom.org/donate.
Welcome to the Feds, insiders bringing accountability, integrity, and reform to a broken bureaucracy. At Feds for Freedom, we value constructive dissent and healthy debate. The views and opinions shared in today's episode are those of the speaker alone and do not express the views or opinions of the U.S. government or any other employer.
Today, we will be hearing from Dr. J.D. Yang, author, medical practitioner, neurologist, and board-certified psychiatrist. We discuss the simple and comprehensive A.C.E.S system he has crystallized for patients to truly own their health and to approach the healing from a whole body, mind, and spirit perspective. Dr. Yang, thank you so much for joining me today. It was wonderful to see you again.
Same here. It's my pleasure.
Well, Dr. Yang, I'd love to start talking about the A.C.E.S program that you have started. The A.C.E.S is a healthcare clinic model that you have developed. A.C.E.S standing for Anatomy, Chemistry, Energy, and Soul. So would you discuss what this is and what is the goal in setting up clinics based on this health model?
Well, now everybody wants to be healthy, right? We have this great movements of make American healthy again. The question is how? And if it's easy, it would have been done. But it is very difficult. And if you think about how confusing the medicine is to people, you know, you have conventional medicine, you have alternative medicine, you have complementary medicine, you have mind-body medicine, functional medicine, anti-aging medicine, regenerative medicine, naturopathic medicine, and all this medicine, Chinese medicine, Ayurveda, and homeopath, you know, all these medicine are so confusing both to patients and professionals. For example, if a doctor wants to learn something more to help their patients, they wonder, which one I should pick, right? And you cannot possibly learn everything, right? Do everything. So they need to have a very clear framework so that they can take better care of the patients as a whole person rather than as a parts. And for the patients too, who they go to if they have problems. You know, if they go to a primary care doctor, did all the tests, all the image, and they couldn't find anything, they say, well, you know, they handle nothing about it. And the patient doesn't know how to take care of themselves, how to find the right providers for them, and how to put a healthcare or medical care team together that takes care the complexity of the human being and the human body and the human health conditions, particularly chronic conditions, very complicated. So I've been practicing and thinking, I basically feel like if we are treating one human being, we don't need so many medicine. We just need one medicine that focuses on what human being is made of. And let's go back to the common sense and to the basics. So human being is made of the body structures, right? Structural integrity is very important. Your hair, your skin, your muscle, your bones, you know, even the membrane of your cells, right? That's all structural integrity. And your gut, you know, the the gut and the body and the brain, and you know, all this structure is very important. And the second, we're made of biochemistry because our structure was supported by, you know, water, vitamins, minerals, amino acids, fatty acids, hormones, enzymes, and neurotransmitters, for example. So we have to make sure we got enough biochemical substances or nutrients we need, but also make sure the biochemical process are balanced and functional. So then that's why do we need the body? Why do we need a chemistry? Because we need to function. How do we function? And that has to translate to what I call the energetic realm of our health. Basically, our body temperature, our heartbeat, our breathing, our bowel movements, our thinking, our feelings, everything has to be generated through electronic physiological activities. So that's why when you go to doctors, actually your doctor measures them. That measures your breathing, your body temperature, your heart rates, and your blood pressure. And then if they want to learn more, they give you EKGs, EEGs, ENGs, EMGs, all these Gs, what they're measuring your electronic activities, which is energy. The energy actually produced in little batteries inside the human cell called the mitochondria. There's thousands, 10,000s of them in one little cell. And everything we eat, everything we breathe in, actually have to go into that mitochondria to be cycled to produce the ATP, so the energy that we have. So energy is not something abstract or, alien. It's actually how we survive, how we function, and how we live, and has a very strong, measurable biochemical and neurophysiological foundation. Of course, Chinese medicine doesn't call electronic activities, they just call them qi, and they also have identified how the energy circulates in the body, how to interact with environments through the meridians, through the acupuncture points, and which actually very much correspond with the modern medical discoveries. So energy is very important. And of course, everything we talk about so far is just a body, but we haven't talked about the essence of the human being is the soul. So sometimes soul sounds a little, people like use spirit or soul, but doesn't matter. It's not really an abstract concept. You can't see the soul, but the soul manifests every moment, every part of your life. It's reflecting how we think, it's reflecting how we feel, and how we behave, how we interact with others, and how we make life choices. So, and consequently, imagine how that will, in return, affects our energy, our biochemistry, and our physical structural body. So I feel like if we focus on these 4 domains, we are taking care of the whole person rather than departmentalize the health or focusing on pieces without addressing the whole.
So you see an issue with the current medical system compartmentalizing all of these different realms, the anatomy, chemistry, energy, and soul. And you have developed an alternative clinic model and medical treatment model that takes all of those and puts them into one. So what does a clinic, an A.C.E.S clinic, look like?
Well, A.C.E.S clinic doesn't provide every medical modalities, like it's not a medical buffet. It is more a assessment system. It's more like compose a music for an individual's life and health. It's more about coordinate, orchestrate the care and the treatment for a person with all the specialists. So, for example, if someone needs a surgery, I do own a cosmetic surgical center where people come, want to have a surgical procedure done, and so they can feel more confident, happier, or healthier. But as an A.C.E.S doctor, I know the surgical procedure only changes the structural part of it, right? And even before we do that, we have to make sure, is anything you could do biochemically or nutritionally that will bring you the confidence and the beauty? Is there anything we can do energetically to achieve that? Or is there anything we have to do, spiritually or psychologically? Because some people, no matter what you do, physically for them, they don't feel good. They don't feel good enough, right? They can't be happy. So if you think beauty is just superficial, you're wrong. Beauty is also four-dimensional. And I think create that A.C.E.S model of aesthetic practice is application of the clinic, A.C.E.S clinic in that area. Same thing can be said for neurological conditions, psychiatric or behavioral conditions, or digestive issues, or cardiovascular issues, or any specialties that you could apply this model and to that a specialty or to that particular patient.
Okay, so why don't you give us an example? Like, say I came in to a clinic and I had gut issues. Like, I knew I'd got some gastrointestinal issues. My tummy hurt every time I ate food. How would you look at that from an A.C.E.S perspective?
Very good question. That's what we run into almost every day. Well, first you have to think structurally. Is anything structurally wrong at this point, right, that cause you problem? As obvious as any ulcers, any inflammations, and any problem that cause the damage of the lignin on the surface of intestines, and because they're very thin, a line of cells. Between cells, that's a little junction, and that junction closes and opens, and to determine what is allowed to be absorbed into the blood, what need to be kept outside. If anything damages that junction or function of that junction or the membrane of that cell, and it causes so-called the leaky gut, okay? And it means things get into the blood they shouldn't. That generates chronic, systematic inflammation because immune system will react. There's certain called allergic reaction, there's certain sensitive reaction, meaning some mediated through antibody, some mediated through cellular reaction response. But as a result, it's caused, overreactive immune response and become quote-unquote autoimmune disease. So autoimmune disease, to me, is either you're genetically vulnerable, but always there is external factors causing it. Body doesn't just suddenly decide to attack itself. Body actually has a great mechanism to protect itself. The reason you have that immune response to the things that shouldn't be in the blood is the body's self-protection. So that's the number one you want to think. You want to think as microscopic as whether there is a structural problems. The second thing is biochemical. Biochemical, you want to look at things come from outside. For example, is there bacteria? Is a virus? Is where dysbiosis means there is not enough balanced probiotics, and whether there are food that with toxins in it, contaminated, or added chemicals, or added sugar, and all these chemical things from the external part. Then there's the internal part, whether our immune system are functional, whether our liver is able to detoxify the toxins, And so that is also internal reasons. And everybody is different. And we're all born with different predisposed, genetically determined weakness. And when we have that weakness, then certain people would react to the same invasion of pathogenic factors and more than the others. Let's take vaccine as example or COVID as example. And some people will get injured terribly. And some people will develop long COVID. Yes, the virus horrible. Vaccine has its own problems to begin with, but the hosts and the people who receive it have a different level of vulnerability. So therefore, they react differently. So that's the biochemical aspects of it. Energetically is very important because how the cell function depends on the energy it receives. The energy receives from blood circulations and oxygens and mitochondrial functions and as well. And another form of energy is energy to detoxify it, and the so-called antioxidants reaction. And another thing about energetic, you see the motility, the measure the digestive system, whether you move or is slow. And a lot of people have a paralysis, that meaning the gut, their bowels, they cannot move, they're stuck, okay? And some people overactive, right? Some people have what they're called irritable bowel syndromes, which they're very much unpredictable. Sometimes it's too much, sometimes not enough. So they're swing between diarrhea, constipation, but always have cramping pain and all that. But one thing that notice is always sensitive to stress. Okay, so why stress is so bad for the gut? But energetically, we understand this phenomenon much better from the Chinese medicine perspective, because Chinese medicine pair our gut with different organs, and different organs paired with different parts of the brain, and different parts of brain that correspond with different emotions. For example, your lungs is energetically paired with your large intestine. And the lungs is very sensitive to grief, loss, and sadness. So when you have that emotional distress, it's not only affecting how your lung function, it's affecting your large intestines. And your small intestine, on the other hand, energetically connect with your heart. The heart is very important energetically and spiritually because that's where your consciousness lives. The lack of direction, lack of meaning and purpose, feeling vulnerable and lost in life is going to affect not only your heart, your sleep, and your mood, is affecting your small intestine functions. And the gallbladder regulates our digestion, so important. And it's paired with the liver. Energetically, liver is very sensitive to emotion of frustration, disappointment, resentment, and anger. And how many of us growing up experiencing some of those things and being suppressed? And particularly among women, actually. A lot of early childhood stress, trauma, and become that. So it causes a digestive problem, irritable bowel syndrome, GERD, and more than that, migraines, uterus, menstruation problems, depression, insomnia, chronic fatigue, fibromyalgia. So those are all energetically related to the liver gallbladder issues. So therefore, when we look at energetic aspects, the Chinese medicine and provide a very good insights. But in A.C.E.S model, I don't want to use Chinese medicine versus Western medicine. I think the Chinese medicine provide a treatment evaluation of energetic part of the human body. So they're not a different medicine. It's the same medicine, but it has more insights into the energetic part of our well-being. And of course, what make you sad? What make you worry? What make you confused? What make you angry? Determined by what? It's by your assessment of what is happening in your life, right? And people and how you assess that. What does it mean something happened to you? Is determined your own value system and your belief and your faith. And that determines how you feel about them. And how you feel determines how you're going to react, respond to it. And consequently, it's going to affect your energy, affects your chemistry, affects your physical structure. For example, if people and feeling like they're angry or resentful about something people said about them or people did to them, and as a really bad thing, they become very angry. Okay, some people, when they're angry, they're screaming, they yell, or some people, were able to process it and respond to it, have a positive, constructive dialogue to solve the conflicts. Some people repress it, suppress the one home and drink, and then become chronic problems. But some people may look at it as a good thing. A lot of people with faith, they look at, seemingly adversary situation in a positive way. They took that as a learning experience. They took that they're able to exercise compassion, tolerance, because they have a faith and a belief. And then they're going to turn the situation totally positive. And so that is why it's very important. We, as a doctor, we've been focusing too much on the cars, but we're ignoring the driver.
Oh, that's a really good way of saying it. Yeah. We've talked a lot about the need for looking at health from all of these different parts of the body. How do you fit that into a medical model? So like an actual practice model. So what does that look like? Do you have the same practitioner who understands all of this, all of these different components of the person, including the energy and the spirit, or are those different practitioners in the same practice?
I think a lot of doctors are doing that without articulating or consciously knowing they're practicing A.C.E.S. So A.C.E.S is not something I created, I invented. I'm just crystallize it, put together as a clear model so that everybody can understand, comprehend, utilize it, and to help themselves and help their patients. I'll give you an example. I had a wonderful orthopedic surgeon and who always sent his patients to me for acupuncture. And he sent his patients to a psychologist for psychotherapy. And he is a great surgeon, and he doesn't practice nutrition, he doesn't practice acupuncture, he doesn't do psychotherapy, but he knows his patients need other teams, other members, other providers to address the issue. Because when people get broken legs, you should ask, not just fix it, you have to ask, what happened? Why did it happen? What was the scenario, situation in your life it happened? If you're drunk driving, why? Right? How do we prevent from happening again? So this is really a great opportunity for medical doctors or surgeons who treat patients when they have lost their health, because that serves as a waking up call. But if we didn't take care of that, if the surgeon or a medical doctor didn't take that opportunity to address that, you will never, ever turn the patient back to the self-care. So that is a time we really need a medical doctor to have that concept. So this orthopedic surgeon, I call him a A.C.E.S surgeon, even though he was not trained as A.C.E.S certified. But now we want that mindset, that framework, to be clearly, consciously practiced by all the medical providers, and so that they can help the patients going back to what I call the healthcare realms, where they take responsibility for themselves, they treat things before they become serious, and they optimize their health, they prevent things from happening.
Now, would you say there is a difference between medical care and health care?
Absolutely. I think this is where we got ourselves into trouble because we confuse this two. And medical care is when people have lost their health and they become sick and they're in crisis, And so they need a medical intervention to save their lives, to control the symptoms, and to stabilize them, right? So then they have an opportunity to reflect, to recover, and maybe to restore, So that's like a medical care. That's a medical treatment. So medical doctors are trained and incentivized to provide the medical treatments, okay? So we should not blame doctors for unhealthy American because they're not incentivized, they're not trained, they're not equipped to do that. Their job is to... So I do want to, those doctors feel good about what they do, but they also need to know they're far from providing health care to their patients. But also they need to know they stand in great opportunity to help the patient to realize what they could have done, what other doctor they should see so they can develop or return to a healthy status of their body, mind, and spirit. So that's the medical care. And same thing with insurance. All insurance called healthcare insurance. They're not. They're medical care insurance. They're like a car insurance. If you don't crash, they don't pay, right? But these words confuse people. Maybe confuse government too. They call them a healthcare system. All the medical centers call them health centers. Insurance call them healthcare insurance. So government give them more and more money, hoping they're going to make American healthy. But that's not their job. That's not what they're incentivized to do. Their job is how we can treat sicker people, how we can save people's life. They want more and more medical wonders, advancement. That's why the medical science and technology has developed so much, but they have nothing to do with the health status of American people because they're not incentivized that. Right. So healthcare, who is responsible for healthcare, right? First and foremost is ourselves.
Yes.
So I think people have to realize that. You have to take control of your health back to your own hands. Don't expect the government will make you healthy again. Don't expect your doctor to make you healthy. You are the one who have to make yourself healthy again. But how? That's where A.C.E.S model comes in. A.C.E.S model provides them a very simple framework. What did I do for my body today? What did I do for my nutrition or chemistry today? What did I do to improve my energy? What did I do to nourishing my soul? Right? So they just need to check. But imagine who can help them to do exercise? Who can help them to sleep better? Who can help them to make choices in food? And who can help them to interact with people around themselves? So I think that is the important things for people they should be empowered, and then they should take ownership. They should be incentivized and supported by the government, the community, and the family, and the workplace.
So what does that incentive look like? So is it money? What does that look like?
I don't know. I've been thinking about it, Instead of say, okay, we probably when anybody was born, the government should give a health fund they can use. In the way the health fund will keep growing, just like investment in money. If you stay healthy, the fund go compounded, just like wealth, like money in the bank, right? And if you got sick, this fund will pay for your sickness care. That means you lose money, I'm just imagining that. So there's many ways the government and the workplace can incentivize people who decide to adopt the A.C.E.S model of healthcare and take the ownership. And of course, the government has their own job because they need to make good public policy. If they make everybody mandated to take a vaccine, that's a bad, right? And so they should provide a good, healthy policy. People should have options and to choose what suits for them, what they need, right? And for their health. And there's no one size fits all. That's a problem with all medical treatments. Everybody take the same medicine, no matter as long as you fit the diagnosis. Everything's standardized. It's not based on the statistics of studies, but not being personalized, individualized. For example, we could really prevent a lot of vaccine injuries if we pre-screen who is going to be more vulnerable to the vaccine because their epigenetic constitutions, their life circumstances, and if they have to have it, what we could do to prepare them to receive it, and how we support them after vaccine, right? And all this can be done, I think that's if we recognize that. So anyway, I think the health care is really a responsibility of themselves, family, community, workplace, and the government.
So there was a study done by McLaughlin and Associates here in Virginia of people throughout all demographics, political parties, and it showed that way over 80%, it was in the 80% range, of people thought that their health was owned by the government and the health insurance industry. 76% said, I don't want the government or health insurance companies to own my health. I want to own it. And in this study, throughout the study, the language was asking questions like, do you want to own your health? Or do you feel like you're renting your health now? So that renting versus owning, it's a great picture.
Yeah.
So we are right there to make policy based on those numbers right there.
Yeah.
So people are recognizing they do want ownership because it has not worked as a government or health insurance ownership model anymore.
Yeah. Well, first and foremost, both, again, I don't like the words health insurance because they're not. Okay.
Medical insurance.
Medical insurance. So I don't know if they have any role to play because they make money betting on people getting sick or a fear of getting sick. And so I don't know what role they play. If they do want to become a true health insurance, they should begin to pay people to go to gym, to see nutritionists, to eat healthy food, to exercise, to meditate, and to see acupuncturists to do natural medicine before they went on the expensive drugs or go to expensive surgical procedures or things like that. So we do need a true health insurance that encourage and pay people to stay healthy. Mm-hmm. So that's number one. And of course, definitely we should not have the same owner who own the health insurance as well as medical treatment system. Again, that's the government job. So government really has a great job in terms of making good public policies and public health policies and personal health policies. And I like what Dr. Ryan Cole said, that if you don't have a personal health, there's no public health. Public is made of each individual person, a human being. If we don't address their individual health, and this public health is a kind of false concept. And so I think the government really need to work on how to incentivize and encourage people to receive the treatment and the modalities and lifestyle choices that promote health, prevent disease, rather than, okay, we only pay for drug, we only pay for procedure, we only pay for your hospitalization, we pay for your recovery. So what we invest as a government is all the results of the disease and all the loss of health. And I think we should reallocate that fund. So I said if I own the Congress, the White House, and the whole system, I said we just need to reallocate the funds. We don't need to cut or increase the spending. For example, we need to pay primary care doctor to educate patients, right? Rather than just send patients to hospital specialists or do the physical checkup. They should spend the time monthly, weekly, educate and monitoring the patient's health. And we should really equip them, educate them to practice full domain whole person care, right? And they need to become a conductor of the symphony and orchestra of a patients. They should have authority to dictate who is doing what or coordinate them. Rather now they're at the bottom of medical system and simply just triage or pass patients to the medical treatments. Couldn't do anything else. So that's why today nobody wants to become primary care doctor. They're poorly paid, they have a low kind of professional status, and they're not supported, equipped, and so that's the reality. I think government can do a lot about it, and they should pay the surgeon the same amount of salary if they operate on 20 patients or 5 patients. Because the U.S. surgeon operate on wrong parts of body 40 times every week, believe it or not. Okay, and we should prevent people from going to hospital because every year the medical error in the hospital kill about 100,000 people a year, particularly during June and July.
Why is that?
That's when residence starts.
No.
Don't get sick around that time. And the drug adversary reactions, which is not side effects. It's nobody prescribe wrong drug, nobody take it the wrong way, unfortunately, just by nature of the medication, about 3 million emergency room visit every year. About 100,000 people killed. Fourth leading cause of death. And if you combine all the medical treatments, hospital errors, drug adversary reactions, it probably kills 500,000 people a year. And why are we so proud of our medical system? And if that is the results we're generating for people who have lost their health, and that's, so I think they should change that. So just reallocate the fund, give more money to self-care, encourage that, incentivize that, give money for the people who help the patients to stay healthier and guide them and treat them with non-invasive, more natural methodology, and minimally using the interventions, expensive diagnostic imagings and procedures. Of course, when you come to that point, you have to. So the healthcare is a full spectrum. That's upstream is a public policy, even political policy. In Chinese, we said the upstream doctor is a doctor who healed the nation. The middle stream doctor is a doctor who healed people, the person. The downstream doctor is a doctor who treats a disease. So you need three kinds of doctor to take care of our health. But now this is a downstream doctor making decision or advice for the middle stream doctor. And downstream doctor help making public, national health policy. Now you know why we're in trouble, right? So we need a new generation of doctors. Yeah. And they're being equipped, they understand their responsibility to heal the nation, they understand and equipped to heal the people, and they're equipped to save lives as well. And that's the medical school I want to build, and I'm working on it. And the Northern School of Medicine Health Science in Middletown, New York, and that's where we're building the new medical school to produce next generation of doctors who can really take good care of our children and grandchildren in the future. But we want to educate existing doctors, healthcare professionals to do that now because we can't wait. So that's another thing I advocate. I'm trying to get grants from NIH or from CMS and to do the pilot study in the rural area for the FQHCs and in the workplace, and also provide education programs so people can begin to adopt and practice A.C.E.S model of medicine and health.
And do you have a website people can go on and see the progress of the building of this school?
Yeah, we are very underfunded and or actually no funding at all. It's just our volunteer work to get things started. We have a website called A.C.E.Swell.com, and which will be a kind of a harbor to provide education for the public, the education for the professionals, and to provide information and transformation for people. And so that's we start with. And I really hope, of course, the A.C.E.S model was developed from my own private practice in the last 20 years called the Young Institute of Integrative Medicine in Philadelphia area. We have 3 clinics, Center City, Philadelphia, Bryn Mawr, Pennsylvania, and Marlton, South New Jersey. And I just started the Northern Medical Center, which is in Middletown, New York, taking care of Medicaid, Medicare people, and trying to apply A.C.E.S model in a different kind of setting, which is very important to get funding and support from the government. And of course, I'm in the process of building the new medical school. And in the last 10 years, the community has acquired 100 acres of land, have renovated half a dozen of buildings that have been abandoned by the New York State. It used to be a psychiatric hospitals. And so we have a building, and we have a great team of the doctors and scientists to develop the A.C.E.S model of curriculum, which address every core curriculum like just every other medical school. But we really want to, we have the curriculum developed, we have the faculty assembled, and we're in the process of applying for the school. Of course, we're only, as I told you, we're $40 million or $50 million away from being able to taken seriously by the New York State for a new medical school. This new medical school really dedicated to train the primary care doctor who equipped with A.C.E.S model of medicine health and dedicated to help the community, to stay healthy. So it is almost, A.C.E.S model is not something new or different. It is really operational system for the MAHA model. Mm-hmm. So if you want to have a MAHA and you need operating system to achieve it, it's almost like a route map as an operational system, but to achieve the MAHA goal.
I have been in, I guess you could say this is alternative. This is alternative to Western medicine as we are used to in this country. But it gets back to the root of humanity, just looking at the body as a whole, not compartmentalized. But I've been in this alternative realm and it gets super expensive. So what's the plan for making this affordable for people like myself? And also, what can be an incentive for, well, I think you spoke a little bit on this, for the medical practitioners who would like to go this way?
Yeah. So first of all, I prefer A.C.E.S model is not an alternative. It is just expanded model to include everything, include conventional medicine. For example, surgery is a part of the anatomy intervention, right? And drug is part of the biochemical intervention, except it's abnormal. It should be small portion of it. The major emphasis should be on nutrients and diet, right? And so therefore, it is really not an alternative system. It is expanded system. It is a complete system, if you will. So that's why I want this model to be all inclusive. Number two, the components has been covered by insurance are the ones who focus on surgical procedures, expensive imagings, and medications. Mm-hmm. Okay, so everything else considered as alternative, but in the A.C.E.S model, they're not alternative. They're essential. Think about the car. Is a battery, engine, an electronic system essential for the car to work? Why energetic medicine of human being can be treated as alternative? It is essential. And biochemistry, why nutrition was excluded? And the drug is paid for. Why dietary guidance and support was alternative?
Yeah.
There shouldn't be alternative.
No.
So there should be an essential part of it. There should be the major part of the health and medical care, right? So if you treat that way, all these services should be covered either by your true health care insurance that are yet to be developed, or by the government, covered service. Mm-hmm. So I think Dr. Oz is trying to, CMS is trying to do a pilot study to prove all those non-covered treatments actually help people with chronic disease to get better. Mm. If that's proven, and the government will have a reason to cover them. But the thing is, a lot of things are time-consuming, but not profitable, like acupuncture. It's very time-consuming, but nobody can make money out of it. Individualized medicine is expensive. Every patient sit with me that spend, if they're my private practice, self-pay, it's an hour, assessment. It's take sometimes 2 hours. But if you are treating people paid by insurance, they only cover certain amount of time and they only pay certain amount. You can't sustain the practice. So it is expensive for practitioners. That's why not many big hospitals provide integrated medicine. They may have integrated medicine department, just like, hey, we have something, trendy and that, interesting, and we are we're following the trend, but there nobody really invests in it, and it's expensive for doctors to run the integrated medicine center. Is very, very hard. So ever since I become integrated medicine doctor, trying to run my clinic, I've been losing money. Always struggle to keep the door open. For patients, it's expensive because the treatments they really need are not covered by insurance. So that's become expensive. So in order to make it all go away, I think once we embrace this A.C.E.S model, and once we embrace the MAHA as the goal, then we will be cover all this, support all this, and train all the doctors to do that. And of course, with modern technology, and things can be simplified, systemized, optimized, and become more efficient and effective. So become less expensive or costly. But nothing costs more, really, than medical treatments. And I see the government is trying to make drugs cheaper. Whenever I hear this, I'm wondering, is that a good thing or a bad thing?
Right.
Right? That means people have more access to drugs. And we all know what drug does or doesn't. And now we also know how much drug has been wasted. There's a billions of dollars drug people prescribe, people refill, but they throw away, either because side effects or because non-compliance or lack of education. Because to be honest, it's unsustainable to be on a drug for a long time without side effects. So are we making things worse? Drug, when you use in the right time and the right people in the right period of time, they're life-saving. But just universally kind of make it accessible, cheaper, I don't know. So that's why the policy, the doctor who healed the nation, doctor who healed the people, and the doctor who treat disease, they have to communicate. They have to share the same vision, same framework, same understanding to be coordinated, right? Same thing with the policy. When we make a policy, we need to have a policy that makes sense from all different angles, okay? So again, I'm not here to criticize the government. I believe to make a important medication affordable for people who really need it is a great thing to do. Yeah, we just need to understand, be cautious about the secondary complications.
I want to go back to something that we initially talked about, the energy and soul part of it, but really focusing on the soul. In Western medicine, soul is left out of the picture 100% of the time, really. And why is that? Why has it been so compartmentalized? And the soul, the real human being at their core, is left out of any kind of whole body treatment. Like when you get sick, why is no one ever asking, okay, have you been under a lot of stress, or did something happen to make this be? We know, studies show that when there's been a trauma, the person is more likely to get sick.
Well, again, it's very hard to separate those two, because what is chicken is like chicken egg issues, right? If you're sick, you create stress, and if you are more stressed, you're more likely to get sick. And then after a while, it becomes a cycle. But interestingly, you mentioned that she gets sick at the same time every year. I had a patient every May. He would have a tremendous respiratory problems with asthma, allergy, and all that. And so it's hard to explain why. And I utilize the mind-body technique called the neuro-emotional technique, and to identify what was a hidden emotional distress or trauma that being reactivated at the same time every year. Because the body has a memory of everything, in their cognition, in their emotions, so we said that you remember things in your head, your heart, and your gut, okay? After a while, you can manipulate what's in your head, so you can choose to forget it, to suppress it, to repress it. But what remembered in your heart, in your gut, never go away. So when that time comes, it automatically being reactivated. So my patients, because that was the anniversary of his father's death, and he was very close to him. He was very young, and that's how we kind of uncovered it, and we work on that, and everything's, and he was to stop having those flare-ups in May. And I think if we use the same technique to work with your mom, we might be able to identify something body remembered and reactivated on the same time. Actually, it's happened to all of us. We all have a suppressed, repressed stress and trauma. They unconsciously determine what we do, what we not do. So the most common phenomenon is a New Year resolution, right? Every New Year, we all gung-ho about what we're going to do, what we're going to change. After 3 months, less than 8% of people can keep that. And why the rest of them couldn't? Because we didn't get our head, our heart, our gut on the same page. Because your head say, I want to do it. Your gut say, I'm not sure. Your gut said, no way. So you're never going to make that happen. But to talk about the soul, why soul is left out in medicine, I think there's two reasons. One is we probably didn't, but we just don't recognize is a issue of soul. For example, as a psychiatrist, we always study people's thought process, what you think, right? And how you feel, and what you say, what you do, and how you relate to people, and how you make life choices, some are healthy, some not. But we don't say this is really reflection where your soul stands. We're just trying to leave the soul out of it, and so we just focus on the manifestation or superficial manifestation of your behavior and treat it superficially. If you think wrong, if a medication can help, we'll give you medication. Okay, if you feel bad, medication make you artificially feel better, right? And you have a certain addictive or self-harm behavior, we medicate you, so hopefully you will change. But guess what? The true reason is not that. It's where the soul stands. So it's interesting, in all the treatment for the people with addiction, the only thing that helpful to a certain degree is the AA programs. What AA emphasize is address your soul. You surrender to high powers, and you invite high powers to help you and dictate your life. Another reason the soul being left out is because we don't want to get involved in religion. People are really sensitive to it. But they can't differentiate between spirituality and religion. Okay? People don't have to have a religion, but very few people say, I don't have a soul. Right? If you have a soul, you have spirituality. And spirituality can be defined, can be measured. It's simple questions to simple answers to 5 big questions that will define your spirituality at the moment you answer it. For example, what is the meaning and the purpose of your life? That's a simple question. You can't give any answers. That's a part of your spirituality. What's your relationship with people around you, with the universe? Again, whatever it is. Is any high power? If there is one, what's your relationship with? You can say, no, I don't think there is higher power. That's fine. That's your spirituality. And does people have past life, future lives, afterlives? Again, you can answer anyway. And then you have to answer, what's your understanding about hardship, tribulations, sickness, disease, and death, right? Whatever your answer is, that defines your spirituality, because those answers determine how you look at the world, how you interact with people, how you make life choices. I mean, that consequently affecting your energetic health, your chemical health, and your physical health. So that need to be purely confined in the spiritual realms and differentiated from religious practice. Okay? Another thing, of course, is hard. What is the medicine for the soul? Is there a medicine for the soul? If there is one, who is the medical doctor of the soul? Right? Actually, there is a medicine, but it's not the doctor we're talking about. So in my practice, I only say, I'm fixing the car. I'm not fixing the driver. But I recognize how important the driver to the health and well-being of the car. Therefore, we should have a conversation about it. We should have a discussion about it. We should bring it up so you can make choices how you're going to take care of your soul. How can you be a better driver? That's it. I can't do anything to you or for you, but I can share with you or we can have a discussion. And actually, when I study all the religion, spiritual practice, West and East, I found something very interesting. If you look at all the teachings by the original teacher, they're very similar. It doesn't matter if it's West or East. In West, Jesus say you need to have an unconditional love for people. And in the East, the Buddha say you should be compassionate no matter what. Isn't that a similar thing? And everybody say you really have a faith. You should trust the creators. Your life was there. You belong there. You should not stuck here. You should do anything good, so you can go home. You can return. You can be quote unquote saved. In East we call it nirvana. You go back. In the West, you being saved. You go to heaven, right? So it's a very similar concept. So that understand that piece of truth and being able to be compassionate and unconditionally loving and be able to sacrifice in order to achieve that. You have to sometimes endure the hardship, right? And so that universal principle or law of the universe seemed to me is the medicine for our soul. And that is what Falun Dafa teaches. Falun Dafa just say, truth, compassion, tolerance. That's it. That's how you use and guide you, cultivate your life. It's not about rituals. It's not about any formalities. It's about whether or not you could apply that in your everyday life, like everybody else. So I think that's the challenging part of the why soul has been kind of left out. But I think it's a time to bring the soul back to medicine, back to health, because without it, we're just trying to fix the car, ignoring the driver.
Yeah, it goes back to it's not going to be government that saves you. It's not going to be a medical practitioner that saves you. It's your relationship with the Lord. So this has been an absolute fascinating conversation. Thank you, Dr. Yang, for coming. I have one last question for you. If the average American citizen could do one thing, and I'm changing it up a little bit today, to better their health, what would it be?
Well, I think they really need to understand this self-care framework, that we are four-dimensional and you have to take care of yourself in four-dimensional way. That's it. And, if that's more important than, someone told me I should take this vitamins, I should take that food or nutrition, because once you have this framework and and operational system, and you can customize that to your own needs. And I think that's more important than anything else. Health and medicine has to be personalized.
That's an excellent answer. Yeah. Well, Dr. Yang, thank you so much for coming into the studio today.
Well, thank you for having me. I'm enjoying our conversation.
Thanks so much for tuning in. Please like, comment, subscribe to, and share our podcasts. I'll see you next week.